So here we are infiltrating the lipomas. There are multiple lipomas over the upper limb. They are painful sometimes to him and obviously not looking cosmetically well. So what we are doing is infiltrating lignocaine, bupivacaine with saline with adrenaline. Okay, so that will make sure that we taking care of the pain. The patient is being operated in sedation, TIVA. So the patient doesn't have pain, he's not moving his hand and he's fast asleep. Okay, so this situation will help us, or this anesthesia will help us to take care of the bleeding also and take care of the pain also. So more of like a tumescent anesthesia. So sometimes patient juggles because he is fast asleep and somewhere confused what is happening around. So he is dreaming. I hope he dreams nice. And do you have any local vein? This thing there? Yes. So these are the small ones here, here, here. A lot of things we have marked. Quite a lot of lipomas, right? And that's it, I suppose. We have infiltrated most of them, and here we go. So we'll start now with the incision and removal. So I do normally the puncture hole technique. So I take the small punctures and they normally pop out like this. See, easy as it seems. Here also it should pop out, and it pops out. Okay, so minimal bleeding and popping out. Can I get the suture, please, sister? And I normally take the simple sutures to make sure that the suture, simple suture, that the scar is bare minimum. As we can see, one suture takes care of all. Similar here, we are already done by the two lipomas of this side. Preferably I take removal sutures to give a good scar. Ideally monocle can give you a bad scar. So the patient is bucking, the anesthesiologist will be taking care of him. So this is how I pop out the lipoma. See? So lipoma has to come out. A small cut. Nothing, this is pure raw surgery, and you're pulling it out, pulling it out, pulling it out. And this is a large lipoma removed with a small cut. You can see. Okay, this is a large lipoma. Over here, removed out. Will you give me a suture, please, sister? By the time she gives me the suture, we remove one more lipoma. Okay, so two more lipomas to be more precise. So here I will be taking a horizontal mattress, single suture. That will make sure that it's healing fine. Bleeding stops on its own. There's nothing to cautery here. There will be a bit of ooze. Okay. Here we go. Thank you. Clean this. Take the suture out. Thank you. Remove this. So as you see, the lipoma pops out. There's a different way of removing it. There has to be gain pressure also. Ideally, many people cannot remove it this way. And there is no 2x or 3x, as we see. It's happening in the same speed as we're going through this video. Suture. Now lipoma here. Remove it entirely. And we have to make sure by feeling it that there is no lipoma. Patient is fast asleep again. push it down here for a sec. Towards the, okay. We'll cut it later. Cut. Thank you. One. Thank you. For a sec. We'll cut it later. And here also we'll take one suture only. The entire lipoma is removed in a small cut. Now the remaining lipomas, this is a big lipoma here, so I take a small cut and I will pull it out. Okay, the patient is having a bad irritation of his throat. Mosquito. No, I think we can get away with the mosquito without the mosquito also. Mosquito. Lipoma we removed. Keep it there. There were tiny lipoma inside also. Extra lipomas. So there can be lipomas around the lipomas. So we have tried to make the capsule of the lipoma, and here comes the different lipoma. Thank you. Can I have the suture, please? That's a different lipoma. Clean. Put that inside. Reception there. Patient is not having any pain because we are given adequate local and there is a lot of sedation. This bleeding will eventually stop. It's just more of a venous bleed, not an arterial bleed. So it has to stop. No other way for it. So sometimes the lipomas are stuck so much that there are a group of lipomas which we need to remove. Can I have a suture, please? A blade, please. Blade or anything, scissor. Okay, thank you. Blade more. Where's the blade? Blade. Okay, thank you. One cut here. One cut here. One cut here. One cut here. Okay. So pause. Okay. Take care of the anesthesiologist to take care of him right now, and he will be doing adequately that. So this lipoma is stuck. It is not easily coming out. So what I am doing is, see, one mosquito, the lipoma is coming out. Doesn't bother me much. It can bother. So being overconfident during this time is not good. Lipoma. Just take it. So there are two lipomas here, invariably. So breaking the lipomas and bringing them out. Here we go. It comes out slowly as we see. And this one more lipoma is coming out slowly. We are out with both these lipomas, as I told you, the two lipomas here, and then we have a large lipoma here also. So it's more of the pressure, how you build it up and how you remove it. There's no big thing in this, but it's an art. I can just tell you that. People might say, how does it help? Decreases the scarring and decreases the operative time. Sister. See here. genuinely popped out. And suture it again. Suture. Okay. You have to maintain the speed. By the time you get bored, it can get more boring. Scissor. Patience, nodding all this while. So we've done till approximately 30 lipomas till now. We've done it on both hands, and we are only 30 minutes into the surgery. Cut. This lipoma has been removed. More we need to remove. We've done many lipomas, till now 5 lipomas I suppose, right? There's nothing here, right? No. 5 more lipomas we need to remove. I think given enough local. Stand up. We injured a vein, the IV I suppose. You know this? No. ये बैंडेज लगे क्या लगे ये ना कट along with this done. No more lipomas, right? We are trying to save all sutures have been done in one this thing only, one suture material. But so we remove all lipomas which we have marked, numbered. They look to be fine. Okay. No more lipomas to be removed. There is a bit of bleeding here because of the IV, I suppose. We hit the vein which is giving the IV, but we'll apply a crepe bandage. The swelling will be taken care of. So superficial swelling is stop on it. Thank you. As we count, we have removed more than 35, I suppose. 1, 2, 3, 4, 5, 6. These are all double lipomas. 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and 31, 32, 33, 34, 35, 36, 37, 38, 39. 39 lipomas have been removed. Thank you.